Hi friends, welcome back. Welcome back to the Nurse YouTube channel. So today we have come up with a very short video which will be very much useful for you for your upcoming nursing examinations. So competitive examinations. So today we have nearly 15 questions which are taken from different topics. Nursing topics which will be covered almost all systems in our body and including nursing research and nursing education. So this video will be definitely will be very well helpful for you to for your upcoming nursing officer examinations. So I'm telling you in the beginning itself, try to watch the video till the end and try to answer these questions, and it is a platform for you to understand the level of knowledge you have. Okay, so before going to our questions, I request whoever watching our channel for the first time and whoever not yet subscribed our channel, kindly subscribe and support us. Okay, so the first question is from OBG. Okay, it is from the OBG. So the first question is, triad of ectopic pregnancy are all except. So question should be very careful. It should be very clear. Triad of ectopic pregnancy are all except. So the options are vomiting, bleeding, abdominal pain, and finally amenorrhea. Okay, so triad of ectopic pregnancy. So what will be the answer? Options are vomiting, bleeding, abdominal pain, and amenorrhea. So the answer is definitely it is vomiting, because vomiting is not included in the classic triad of ectopic pregnancy signs. Okay, so the classic triad of ectopic pregnancy include pain will be there, definitely pain will be there, then amenorrhea will be there, and vaginal bleeding. Okay, pain, amenorrhea, and vaginal bleeding. Okay, these are the classical triad of ectopic pregnancy, and often the first warning sign of an ectopic pregnancy are light vaginal bleeding and pelvic pain. Okay, so it should not be confused. The triad of ectopic pregnancy are pain, amenorrhea, and vaginal bleeding. I think it's clear for you. So moving on to the next question. The next question is from the pediatrics. So pediatric growth and development. The question is, physical growth is rapid during which stage of growth and development? So the question is very clear. It's a direct question. Physical growth is rapid during which stage of growth and development? So the options are, the first one is the infancy, second one is preschool, third one is adolescence, and the last one is neonatal. So the stages of development you have to keep in your mind, and what all things are happening during these developmental periods also should come to your mind. So once again, I will tell you the options. The first one is infancy, second one preschool, third one adolescence, and the fourth one is neonatal. So definitely what will be the answer? So the answer is infancy. Okay, so you know that the infancy period is the life stage development is very crucial, as this is the initial period which truly determines a person's health in all ways, like physical ability, immunity, physiological development, intellectual development, and even the psychological development. Okay, so the growth during the infancy period is very rapid, and you know that the baby may even appear new each day. Okay, the baby may be different when compared to the last week or the last day. Okay, and they are learning new things, and they will grasp things very quickly. Okay, so the infancy period is the rapid is the stage in which the rapid growth is happening. And an additional information, you know that the neonatal period is between 0 to 28 days. Okay, the 0 to 28 days, approximately 1 month, is the neonatal period, and infancy period will be from 1 month to 1 year. Okay, 1 month to 1 year. Neonatal period is between 0 to 28 days, and the infancy period is between 1 month to 1 year. Okay, so that is clear for you. Now we have covered 3 questions. The next question is from the cardiovascular system. So here is the question. The first branch of human aorta is, okay, so the question is, it's a direct question. First branch, which is the first branch of human aorta? So keep the structure of aorta, ventricles, everything in your mind, and here comes your options. The first option is left subclavian artery. The second one is the brachiocephalic trunk. Third one is the coronary artery, and the final one is the left common carotid artery. So I repeat the options: left subclavian artery, brachiocephalic trunk, coronary artery, and left common carotid artery. So what is the answer? So the answer is brachiocephalic trunk. Okay, so you know that from the left ventricle we have the aorta will be arising from there, and aorta will travel up. That means it is in the ascending pathway, that is the ascending aorta, and it will form an arch which is known as the arch of aorta. Okay, so in these areas there won't be any branches. Okay, the aorta is not creating any branches in these areas. The aortic arch give rise to several important branches. Okay, from the aortic arch several important branches are forming, and the first branch of the aorta is normally the innominate artery, otherwise known as the brachiocephalic trunk. So here comes our answer. Okay, so the arch of aorta, from the arch of aorta the first branch is called as the innominate artery, otherwise known as the brachiocephalic trunk, and shortly after its origin, after the brachiocephalic trunk has originated, it divides into the right subclavian and right common carotid artery. Okay, so don't be confused. First is the aorta, from the aorta ascending aorta, arch of aorta, from the arch of aorta brachiocephalic trunk or the innominate artery, from the innominate artery it divides into two as the right subclavian artery and right common carotid artery. So the answer is clear for you. So for the answer of our question, that is the first branch of aorta, human aorta, is a brachiocephalic trunk. So moving on to our next question. The next question is from the gastrointestinal system, and it is related to cirrhosis or hepatic encephalopathy. So here is your question. The question is most common clinical manifestation in hepatic encephalopathy. Okay, the most common clinical manifestation in hepatic encephalopathy. So from the options itself, it is very easy question. So the first one is increased urine output. The second one is altered level of consciousness. Third option, decreased tendon reflex or hyporeflexia. And the last one is hypotension. Okay, so what will be the answer? Hepatic encephalopathy. That question, from the question itself, it is easy to understand, but it's quite confusing also. The options are quite confusing also. Options are increased urine output, altered level of consciousness, then hyporeflexia and hypotension. So what is the answer? Hepatic encephalopathy. So the answer is altered level of consciousness. Okay, so changes in the behavior and level of consciousness are the first signs of hepatic encephalopathy. So there will be changes in the behavior like confusion, confusion will be there, then decreased decision taken capacity, poor judgment, then altered level of consciousness. These are all the first signs of hepatic encephalopathy. And hepatic encephalopathy is caused by liver failure, and it develops when the liver is unable to convert some protein metabolic products like ammonia to urea. So what will happen is ammonia will be built up or accumulated, and the other toxic substance also will be accumulated in the blood, and it will damage the cells, which results in hepatic encephalopathy. Okay, so this is the pathophysiology for the hepatic encephalopathy. So coming back to the options, some more details I will tell you about the hepatic encephalopathy. And you know that hepatic encephalopathy is coming as a result of cirrhosis of liver, which in turn is caused because of the portal hypertension. Okay, so coming to the options, you can see that the first option is increased urine output. So that is wrong, because why? There will be decreased urine output. Then you will have a query, you will have a doubt like how liver cirrhosis or the hepatic encephalopathy will affect the kidney functions. There is a syndrome called hepatorenal syndrome, in which the patients with the cirrhosis of liver or the hepatic encephalopathy, they will be having decreased kidney functions also. Okay, which will be manifested by increased renal function test, like there will be urea will be more, creatinine will be more, and this condition is termed as the hepatorenal system. Okay, this is happening because of the difficulties in the blood supply to the kidneys because of hepatic enlargement. Okay, so that is a hepatorenal syndrome, and in that there will be decreased urine output as a result of the renal failure. Okay, so the first option is wrong. Second option is the answer. The third one is the decreased tendon reflex option. So that is wrong. In hepatic encephalopathy, you can see increased tendon reflexes, that will be hyperreflexia will be there. Okay, and the fourth option is hypotension. That is also wrong, because in hepatic encephalopathy and in the cirrhosis of liver, there will always be hypertension will be there, portal hypertension will be there, and because of fluid overload, ascites and all, definitely there will be hypertension will be there. Okay, so by the process of elimination also you can find out the answer for this question. Okay, so our answer is altered level of consciousness. This is clear for you now, no? Now moving on to the next question. So the next question is from the central nervous system and it is related to epilepsy or the seizure disorder. So the question is, which is a specific investigation of diagnosing seizure disorder? So the question should be very careful. What is the specific investigation used for diagnosing seizure disorder? And we have the options EMG, EEG, ECT and ECG. Okay, so it should not be confused with the options. First one is EMG, next one is the EEG, third one is ECT and the final one is ECG. So what is the answer? So definitely you know that the answer is EEG, otherwise known as the electroencephalogram or encephalogram. So EEG results show changes in the brain activity that may be useful in diagnosing brain conditions, especially seizure disorders and other epilepsy and other seizure disorders. Okay, so an electroencephalogram or EEG is a test that detects the electrical activity in our brain using small electrodes which are attached to the scalp of our head. Okay, attached to our scalp. Okay, so that is EEG. Then what is EMG? EMG is otherwise not is a short form for electromyography. Electromyography. So from the term itself, myo stands for muscles. So it's a diagnostic procedure to assess the health of muscles and the nerve cells that control them. Okay, health of muscles and the nerve cells that control them. That means the motor neurons. Okay, so EMG results can reveal nerve dysfunction, muscle dysfunction, or problems with the nerve to muscle signal transmission. Okay, nerve dysfunction, muscle dysfunction, or if there is any problem with the transmission of signals between the nerve to muscle, that also can be identified with the help of EMG, otherwise known as the electromyogram. Okay, so what is ECT? You know that it is a electroconvulsive therapy and it is a procedure which will induce the seizure. Okay, it is not a treatment for seizure, it will induce the seizure, and it is a procedure which is done under the general anesthesia, in which small electric currents are passed through the brain, intentionally triggering a seizure response, a brief seizure response. Okay, so that is ECT. And the final one is the ECG. What is that? That is electrocardiogram. So you know that it is a simple test that will be used to check our heart rhythm and electrical activity. Okay, so this is for the question what we have asked here, answer is EEG, otherwise known as the electroencephalogram. Okay, so moving on to the next question. The next question is from the fundamentals of nursing, and it's a direct question, and the question is, water temperature for tepid sponging should be between. So what should be the water temperature for tepid sponging? Okay, so we have the options. The first option is 16 degrees Celsius to 22 degrees Celsius. The second option is 32 degrees Celsius to 35 degrees Celsius. The third option is 42 degrees Celsius to 44 degrees Celsius. And the final option, 3.7 degrees Celsius to 4.2 degrees Celsius. Okay, so what is the answer? The question is tepid. So tepid. So what is the answer? So the answer is the option number 2, 32 degrees Celsius to 35 degrees Celsius. So we know that for tepid sponging we have to use lukewarm water. Okay, lukewarm water is a water which is having in the in the room temperature. Okay, just above the room temperature, that will be around 90 degree Fahrenheit to 95 degree Fahrenheit, and which will be in the Celsius scale it will be 32.2 degrees Celsius to 35 degrees Celsius. Okay, so the answer is 32 degrees Celsius to 35 degrees Celsius. That's the second option. Then what will be the temperature for sitz bath? So in the option it is there, that is 42 degrees Celsius to 44 degrees Celsius is used for sitz bath, and for the cold compress we are using a temperature between 3.7 to 4.2 degrees Celsius. Okay, so sitz bath it is 42 degrees Celsius to 44, and for cold compress the temperature is very low, that is 3.7 to 4.2 degree Celsius. So for tepid sponging our answer is option number 2, 32 degrees Celsius to 35 degree Celsius. Okay, it's clear. Now moving on to the next question. Next question is from the psychiatry. The question is, the treatment of choice in depression with suicidal tendencies. So question you should thoroughly you have to see, treatment of choice in depression with suicidal tendencies. Okay, so we have the options. The first one is tricyclic antidepressant. The second option is the MAO inhibitors. The third one is a fluoxetine, and the final one is electroconvulsive therapy or ECT. So what is the answer? So you know that the answer is ECT. Okay, the first and the most important indication for ECT is depression with suicidal tendency. Okay, depression with suicidal tendency is a psychiatric emergency, and before giving any medicines are also important. So before medicines itself, what we have to do is we have to pose the patient for ECT. Okay, so moving on to the other options. Okay, the first one is a tricyclic antidepressant. You know that it is the name itself, it is there. TCA or the tricyclic antidepressants like amitriptyline are used for the treatment of depression. Then MAO inhibitors. So MAO inhibitors are used for depression. It is also a class of antidepressants like selaginil are the examples of the MAO inhibitors. Then the third option is fluoxetine. You know that fluoxetine is an SSRI, that is selective serotonin reuptake inhibitor, which is also a class of antidepressants. Okay, so all these are antidepressants, but here in the question they have clearly asked the patient is presented with the suicidal tendencies, then we should consider it as a psychiatric emergency and we have to pose the patient first for ECT. Okay, so that is clear. So the next question, one more question from the psychiatry. The question is, which among the following drugs should be avoided during pregnancy, especially in the first trimester? Okay, so the question I repeat, psychiatric drug that is to be avoided especially in the first trimester of pregnancy. So here comes the options. The first one is a chlorpromazine, second one is a haloperidol, third one is a carbamazepine, and the final one is a lithium. So which is the answer? Chlorpromazine, haloperidol, carbamazepine, and lithium. So the answer is lithium. Yeah, lithium is the answer. So lithium, you know what is a lithium? Lithium is a mood stabilizer which is used in the treatment of mania. Okay, so the risk of major congenital malformations are there, especially Epstein-Barr anomaly and congenital heart diseases are more with the use of lithium during the first stage of first trimester of pregnancy. And the other drugs, you can see the other options. The first one is a chlorpromazine. Chlorpromazine is an antipsychotic. It is safe during pregnancy. Then haloperidol is an antipsychotic. Then what is a carbamazepine? Carbamazepine also is a drug which is used for it can be used as an anti-epileptic drug, and for a chronic pain we can use carbamazepine, and for bipolar disorders, especially bipolar mood disorders, we can use carbamazepine. Okay, so among these options, lithium is a teratogenic drug which can cause serious congenital malformations like Epstein-Barr anomaly and all. So it should be avoided during the first trimester of pregnancy. Clear? So moving on to the next topic, which is very important in the present scenario. So the question is, which is the recommended disinfectant specific for killing coronavirus? So the question I repeat, recommended disinfectant specific to killing coronavirus is. So here comes the options: phenyl, carbolic acid, sodium hypochlorite, and the final option is Lysol. Phenyl, carbolic acid, sodium hypochlorite, and Lysol. So what is the answer? So the answer is sodium hypochlorite. Okay, you know that sodium hypochlorite or NaOCl is a solution which is made from reacting chlorine with a sodium hydroxide solution. Okay, sodium hypochlorite, commonly known as the bleach, is most frequently used as a disinfecting agent, and it is a broad spectrum disinfectant which is effective for the disinfection of viruses, bacteria, fungi, and mycobacterium. Okay, so this is a very important and it's a very needed solution, especially for coronavirus like viruses. Okay, so coming to the other options, phenyl, all other options like phenyl is a cleansing agent, like it's a sanitation solution. Carbolic acid, otherwise known as the phenol, this is also can be used as a cleaning solution. And Lysol, it is a brand name and it contains phenol derivatives. Okay, phenol formulations are there, and Lysol is a brand name. So in these options, the sodium hypochlorite is very much specific for killing viruses like coronaviruses. Okay, so our answer is sodium hypochlorite. Clear? So moving on to the next question, that the next question is from the renal system. So the question is, which are the most common types of renal stones? Okay, which are the most common types of renal stones? It's a direct question. So your options are uric acid stones, struvite stones, calcium stones, and cystine stones. Options are uric acid stones, struvite stones, calcium stones, and cystine stones. So what is the answer? most common type of renal stone? So the answer is calcium stones. Okay, calcium stones are the most common type of renal stones. So from the other options we will get answer for so many questions. So I'll explain it in little detail. So calcium stones including the calcium oxalate and calcium phosphate stones. Okay, calcium stones means there are two types. There will be calcium oxalate stones and calcium phosphate stones, and among these the most common type is the calcium oxalate stones. Okay, calcium oxalate stones are more common than the calcium phosphate stones. And if the question comes like which is if in the options, if you get two options like calcium oxalate and calcium phosphate, you have to choose calcium oxalate. Okay, so coming to the other options, what is a struvite stone? How struvite stones are formed? Struvite stones are formed in response to a urinary tract infection. Okay, in response to UTI, which stone will be formed? If such a question is asked, the answer will be struvite stone. Then the next one is a uric acid stone. Uric acid stones can form in people who lose too much fluid because of the chronic diarrhea, malabsorption, and those who eat a high protein diet, and those with diabetes or metabolic syndrome. Okay, so many questions can be asked from this one question itself, for diabetic patients or patients with metabolic syndrome, which is the most common stone, then the answer should be uric acid stones. Okay, and the last one is the cystine stones. Cystine stones means these stones are formed in people with a hereditary disorder called cystinuria, where the kidneys excrete too much of a specific amino acid. Okay, that is cystine stones. Okay, so uric acid stones in metabolic conditions and in diarrhea, malabsorption, diabetes, etc. Struvite stones followed by UTI. Calcium stones is the most common type of renal stones, and cystine stones in patients with the cystinuria. Okay, it's clear. So moving on to the next question. The next question is from the respiratory system. So the question is, barrel chest occur in which disease condition? Okay, barrel chest occur in. So the options are, first one is empyema, the second one is emphysema, third one is pneumothorax, and the final option is pleural effusion. Empyema, emphysema, pneumothorax, pleural effusion. So what is the answer? It's a direct question. Barrel chest. Answer is emphysema. Okay, emphysema, you know that barrel chest is a visible symptom of chronic obstructive pulmonary disease or COPD, and in the COPD itself, it's there is a emphysema, then osteoarthritis, and heart failures. Okay, and we can see that the lungs will be filled with air and are unable to fully breathe out. Okay, the patient will not be able to completely breathe out, and this gives the chest a pronounced barrel shape. Okay, that's how barrel chest will be formed in these conditions like osteoarthritis, emphysema, COPD, etc. Okay, so the answer for our question is emphysema. And the other options, what is the empyema? Empyema is a pus collection of pus in the space between the lung and the inner surface of the chest wall, that is in the pleural space. Pneumothorax is the collection of air in the pleural space, and pleural effusion, you know that the fluid collection, okay, in the pleural space. Okay, space. So answer for our question, barrel chest, is seen in emphysema. Okay, so next question is from the ear. Next question is from the ear anatomy. So the question is, what is the organ of hearing called? Question is, what is the organ of hearing called? So the options are, the first one is vestibular system, the second option tympanic membrane, third option is cochlea, and the final one is semicircular canals. Options are vestibular system, tympanic membrane, cochlea, and semicircular canals. So what is the answer? Simple question. Answer is cochlea. Okay, you know that cochlea is a very hollow spiral shaped bone found in the spiral shaped bone which is found in the inner ear, and which plays a key role in the sense of hearing, and it is participating in the process of auditory transduction. Okay, that is cochlea. Cochlea means it's a hollow spiral shaped bone which is found in the inner ear that plays a key role in the sense of hearing, and it participates in the auditory transduction. Okay, so which is the organ of balancing organ of balancing is in the vestibular system, and it is the apparatus of the inner ear involved in the balance. And the semicircular canals also are three tiny fluid filled tubes in our inner ear that also helps to keep our balance. When we move the head to from one side to the other side, or from forward to backward and all, the balance will be maintained with the help of the semicircular canals. Okay, so who are having much doubt about this question, or the anatomy of the ear, can go through the inner ear anatomy, which is also very much important for exams. Okay, so the next one is from the eye. Okay, what is the inflammation of eyelid is called? The question is, inflammation of eyelids is termed as dash. Your options are conjunctivitis, blepharitis, stye, entropion. Okay, entropion, stye, blepharitis, conjunctivitis. So what is the answer? Answer is blepharitis. So blepharitis, you know that it is the inflammation of eyelid. And what is conjunctivitis? Conjunctivitis is the inflammation of the conjunctiva. It is the term itself, it is understood. Then what is a stye? So we should not be confused with stye and blepharitis. Okay, stye is a red painful lump which can be seen near the edge of the eyelid. Okay, it will be seen in the edge of the eyelid that may look like a boil or a pimple. Okay, there will be mild inflammation will be there, and along with that there will be a projection like a pimple or a boil, and it will be occurring in the corner. Okay, near the edge of the eyelid. Okay, so that is known as the stye. So it is different from blepharitis. Blepharitis is pakka, it is in the inflammation of the eyelid. Then one more option is there. You can see that what is entropion. Entropion, it is a condition in which your eyelid turns inward. Okay, eyelid will be turned inward so that your eyelashes and the skin rub against the eye surface. Okay, against the eye surface there this eyelid this eyelid will be turned inward so that it will touch the eyelashes and the skin. It will rub against the eye surface. Okay, so that is termed as the entropion. And one more term is there, extropion. That is the opposite of entropion. Okay, so inflammation of eyelid. Answer for our question is blepharitis. Okay, clear. So coming to the second last question. So that question is from the research, and the question is, a group of people, objects or items that are taken from a larger population for measurement is termed as. So the question is, a group of people, objects or items that are taken from a larger population for measurement is termed as. And the options are, first one is the baseline, second one is case study, third option is sample, and the final one is data. So options I repeat: baseline, case study, sample, data. So what is the answer? This question is very important. So the answer is sample. Okay, so sample, you know that, okay, it is the population researched in a particular study. In simple ways we can explain it as the population researched in a particular study is termed as the sample, and it is a group of people or objects or items which are taken from a larger population for the measurement. Okay, so that is known as a sample. So coming to the other options, what is a baseline? So we heard that the baseline value, like a normal range, if we are taking the normal range of the BP, we have a normal range. So what is a baseline? Baseline is a control measurement carried out before an experimental treatment. Okay, so we will keep this as the this as a source, or this as a baseline for comparison. Okay, so it is a control measurement carried out before an experimental treatment, that is baseline. So then what is a case study? Case study means the collection and presentation of detailed information about a particular participant or a small group, frequently including data derived from the subject themselves. Okay, so case study is the collection and presentation of detailed information about a particular topic or a particular participant or a small group. This is frequently including the data derived from the subject themselves. Okay, that is case study. Then what is data? Our last option. What is data? Data is a factual information used as a basis for reasoning, discussion, calculation, etc. Okay, data is some data. Data means it's a factual information used as a basis for reasoning, discussion, or calculation. Okay, so the answer for our question is sample. Okay, so moving on to the last question of our video today, that is from the nursing education, and the question is, most commonly used teaching method is. the most commonly used teaching method is, and the options are discussion, lecture method, demonstration, role play. Okay, the question is the most commonly used teaching method: discussion, lecture method, demonstration, role play. So what is the answer? The answer is lecture method. You know that lecture method is the oldest method of teaching. It is the oldest method of teaching, and it is the most common method of teaching. And coming to the other options, the first option is discussion. What is a discussion? Discussion, sorry, first we will explain about the demonstration. So what is a demonstration? Demonstration is the process of teaching someone how to make or do something in a step-by-step process. Okay, and it is very much important in our nursing clinicals, nursing education. It is very, very important. Demonstration, like a demonstration of procedures and all. So it is a method in which the teacher will be educating the students to how to make or do something in a step-by-step process. Then what is a role play? Role play is a technique that allows the students to explore realistic situations by interacting with other people in a managed way in order to develop experience and trial different strategies in a supported environment. Okay, so what is a role play? Role play is a technique that allows students to explore realistic situations by interacting with each other, with other people in a managed way in order to develop experience and trial different strategies in a supported environment. Okay, so that is role play. Okay, so answer for our question, the most commonly used teaching method, that is lecture method. Okay, so that's all about today's video. I think these 15 questions which are taken from different areas will be helpful you to understand the level of your knowledge, and you can identify in which area you have to concentrate. So thank you for watching the video, and I request everyone to be stay tuned for the next video to come, and we will be uploading shortly another videos with this in the same manner. Okay, and it will be very, very helpful for you. So once again, thank you for watching the video. Stay tuned. Thank you.